Hi guys. For our professional ethics and diversity presentation, we are going to talk about the Amish culture and nursing implications. A Swedish Mennonite named Jacob Ammon separated from the Mennonite Church in 1693 to form a new fellowship, and his followers were called Amish. The first Amish to arrive in North America arrived between 1714 and 1727 and settled in Lancaster County, Pennsylvania. The Amish followed 5 basic tenets: adult baptism, separation of church and state, excommunication from the church for those who break moral law, living life in accordance to teachings of Christ, and refusal to bear arms, take oaths, or hold political office. They live a simple life to reject worldliness, vanity, and materialism. Traditional culture, health beliefs, and practices of the Amish. The Amish brought to America the traditions and home remedies from their country of origin and are more apt to try herbal, natural remedies before seeking care from modern medicine, such as echinacea for cold and flu symptoms, herbal tablets, garlic, and vitamins are their self-prescribed first-line treatment against illness. Barash is a folk healing art that has a major role in Amish folk care and refers to sympathy curing. They refer to the Barash as warm hands and is an attempt to heal human ailments with words, charms, and physical manipulations. Death is not feared because it is regarded as the doorway into a better life. Because of this belief, they do not believe in prolonging life and with life support technology or with taken care of by family in their home. The Amish sometimes travel to other states and sometimes even to Mexico for alternative care that they feel can be effective, such as lateral clinics in Mexico, uranium mines in Colorado, and thermal springs in Arkansas. And they also seek chiropractic care, usually because they believe it will be effective and at less cost than seeking treatment at a hospital. Nursing implications in caring for the Amish population include language barriers and pediatric patients. In the Amish culture, children speak Pennsylvania Dutch at home until they begin school, and then they begin to learn English. So a language barrier might be present in the pediatric population, and the nurse will have to connect with and communicate with the parents in order to communicate with the child. Although not opposed to seeking modern medical treatment, it is usually the last choice due to cost and their lack of insurance, so most clients tend to be very ill and often have undiagnosed comorbidities. The nurse should not belittle or question why medical care was not sought sooner, but treat the medical issue at hand and be respectful and mindful of their culture while doing so. While the Amish try to prevent and fight disease and illness with herbal and folk remedies, they are not opposed to modern medical treatment and look for trust and open communication with a provider. It is one of the key points they value in choosing a provider. Nurses can promote health promotion through healthy eating choices and vaccinations that are low to no cost in rural counties such as Lancaster. Palliative care in the Amish culture and nursing implications for palliative care in the Amish culture are vast because of their belief to not prolong life and view death as natural, and the choice of home care for the elderly and sick. Nurses can make a difference by offering home resources, comfort measures, and be available when help is needed. An ethical dilemma that we wanted to talk about is an Amish woman age 65, was brought into the emergency department for worsening cough and shortness of breath. Lab work and test results diagnosed her with congestive heart failure. As a nurse, one knows she needs diuretics and would benefit from oxygen therapy. The patient is of sound mind and chooses to go home and let whatever happens happen. The dilemma comes because we are ingrained to do no harm and to do good, and in mind of a nurse, death will occur if treatment is not obtained. But to respect her beliefs, we have to respect her right to go home and not receive inpatient treatment, but could recommend home care and supplemental portable oxygen. This concludes our cultural presentation on the Amish. I hope you enjoyed it.